Welcome to another video. This video includes 10 nursing practice questions to teach you how to master the NCLEX. At the end of the video, check out the description for studying resources and more. Practicing nursing questions frequently is the best way to pass many nursing exams. Now let's begin. Starting with question 1. A client is dilated 8 centimeters and entering the transition phase of labor. Common behaviors of the laboring woman during transition are frustration, vague in communication; seriousness, some difficulty following directions; calmness, follows directions easily; excitement, openness to instructions. The correct answer is frustration, vague in communication. During the transition phase, the mother may become frustrated and unclear in her communication owing to severe pain and fear of loss of control. A female client admitted to the labor and delivery unit thinks her bag of water broke approximately 2 hours ago. She is having mild contractions 5 minutes apart. The most immediate nursing intervention would be to note the color and amount of fluid on her clothes, assess the fetal heart rate, notify the physician, place the nitrazine test paper at the cervical OS and note the color change. The correct answer is assess the fetal heart rate. With rupture of the membranes, the umbilical cord may prolapse if the presenting part does not fill the pelvis. Assessing fetal heart rate ascertains fetal well-being. A postoperative TURP client returns from the recovery room to the general surgery unit and is in stable condition. 1 hour later, the nurse assesses him and finds him to be confused and disoriented. She recognizes that this is most likely caused by hypovolemic shock, hypokalemia, hypernatremia, hyponatremia. The correct answer is hyponatremia. Important early clinical findings of a decreased sodium concentration include confusion and disorientation. Hyponatremia can occur after a TURP because absorption during surgery through the prostate veins can increase circulating blood volume and decrease sodium concentration. The nurse documents a client's surgical incision as having red granulated tissue. This indicates that the wound is infected, not healing, necrotic, healing. The correct answer is healing. The wound is healing properly and is filled with red granulated tissue and fragile capillaries. A 19-year-old client fell off a ladder approximately 3 feet to the ground. He did not lose consciousness but was taken to the emergency department by a friend to have a scalp laceration sutured. The nurse instructs the client to clean the sutured laceration twice a day with povidone iodine, betadine. Remove his scalp sutures after 5 days. Return to the hospital immediately if he develops confusion, nausea, or vomiting. Take meperidine 50 mg by mouth every 46 hours as needed for headache. The correct answer is return to the hospital immediately if he develops confusion, nausea, or vomiting. Confusion, nausea, vomiting, and behavioral changes may indicate increasing intracranial pressure as a result of intracerebral bleeding. On admission, the client has signs and symptoms of pulmonary edema. The nurse places the client in the most appropriate position for a client in pulmonary edema, which is high Fowler, lying on the left side, sitting in a chair, supine with feet elevated. The correct answer is high Fowler. High Fowler position decreases venous return to the heart and permits greater lung expansion so that oxygenation is maximized. The most frequent cause of early postpartum hemorrhage is hematoma, coagulation disorders, uterine atony, retained placental fragments. The correct answer is uterine atony. The most frequent causes of hemorrhage in the postpartum period are related to an interference with involution of the uterus. Uterine atony is the most frequent cause, occurring in the first 24 hours after delivery. A 52-year-old client who underwent an exploratory laparotomy for a bowel obstruction begins to complain of hunger on the third postoperative day. His nasogastric tube was removed this morning, and he has an IV of D5W with 0.45% normal saline running at 125 ml per hour. He asks when he can get rid of his IV and start eating. The nurse recognizes that he will be able to begin taking oral fluids and nourishment when it is determined that he has no signs of wound infection. He is able to eat a full meal without evidence of nausea or vomiting. The nurse can detect bowel sounds in all 4 quadrants. His blood pressure returns to its preoperative baseline level or greater. The correct answer is the nurse can detect bowel sounds in all 4 quadrants. Routine postoperative protocol for bowel obstruction is to assess for the return of bowel sounds within 72 hours after major surgery, because that is when bowel sounds normally return. If unable to detect bowel sounds, the surgeon should be notified immediately and have the client remain NPO. Newborns are routinely screened for phenylketonuria. The nursery nurse ensures that this screening test is performed immediately after birth, because the most accurate result is obtained at this time. After 23 days of milk ingestion. At 23 days of age, regardless of amount of milk feedings. At 1 month, because the biochemical buildup of phenylalanine takes 1 month to detect. The correct answer is after 23 days of milk ingestion. It is important that the infant take in 23 full days of milk or formula feedings to preclude a false negative reading. A 20-year-old female client delivers a stillborn infant. Following the delivery, an appropriate response by the labor nurse to the question, "Why did this happen to my baby?" is, "It's God's will. It was probably for the best. There was something probably wrong with your baby. You're young. You can have other children later. I know your other children will be a great comfort to you. I can see you're upset. Would you like to see and hold your baby?" The correct answer is I can see you're upset. Would you like to see and hold your baby? Holding and viewing the infant decreases denial and may facilitate the grief process. The nurse should prepare family members for how the infant appears and provide support. Well, that's it with this video. See you next week for another set of questions. Leave a comment saying how many you got correct.